Well, hello everyone. Today I'm going to talk about our experience with the Philippine healthcare system. So, this is what happened. One day, this was back a few months ago, around 10 o'clock in the morning, me and my wife just heard this loud scream, repeated screams. And first we thought somebody listening to the TV pretty loud, but then we realized it was somebody outside, shouting for help. And we looked out, went outside, and there it was the woman, old lady, grandmother, with her grandson, who's about 3 to 4 years old. She's screaming out and crying for help. So we go over there, and the little boy, I'm not going to lie, looked very lifeless. And even though he's not related to us, still you feel compassion. You don't want to see a young child die. So you try to do whatever you can. And really have to be careful how we approach the situation, because sometimes when you want to help, you can cause damage, and then you never forgive yourself the rest of your life. So what happened, she was screaming out for help. She didn't know what's wrong with the kid. But his head was hanging, his arms like lifeless, so we touched the neck part, the artery, and it still had, feel the heartbeat, and he was breathing very, very slow, breathing. So I was asking my wife, I said, please call the ambulance out. I don't know what's the number here, you never have to use it. But I know in America you call 411 and in a few minutes they're out there, fire department, police, ambulance. But here, my wife said it takes forever sometimes for them to get here. It's not that they don't want to do it, it's the lack of manpower, not enough people doing it. And the traffic, the terrible traffic conditions, and getting in and out of the subdivisions because they're very narrow roads. So my wife said, we're better off just put them in our truck and go straight to the hospital. I said, okay, great. If you know where to go, then we're going straight there. And it took us about 20 minutes to get there. Then when we go inside, I was shocked because I remember going to emergency room, and when I lived in the United States, sometimes with my kids had to be taken there. And so here it's very different. It's a huge room. I don't think air conditioning was working at all. Everybody's sweating really bad from the heat, and not enough staff. You can tell just by the look of people, they're extremely stressed out. And so it's just a different world, to say. And but they all dedicated to work, so it's not like I'm not putting anybody down. I salute the healthcare workers. It's very extremely hard for them and stressful. So it was like nurses like hopping one patient to the other one, taking the information, then taking the temperature, but it's so many of them, and nobody has a separate room with a little curtain maybe between, and you can tell the doctor when they come exams, very stressed out because it's like non-stop, like in a meat grinder, 10 hours a day. And then he says the kid has the nurse said that the little child, boy, has extreme high fever. Really high. And he's very dehydrated too. So I said, okay, then why don't you give him a shot or some tablets to reduce the fever? No, we don't do it like this in the Philippines. This is public hospital, not private. And so we have to go out and get the fever reducer and pain reducer. I said, where the heck are we going to go? We had no idea where to get it. Okay, you can find little pharmacies just about anywhere, but we weren't prepared. We didn't bring cash with us, just jump in a truck. We had a credit card on us. And a grandmother who was there with the child, she didn't have nothing on her. So we're going out. We had to go to 3 different places where they finally accepted the card. And went back to the hospital and gave the medication. But I'm just making this vlog because I want to show the people who come from other countries that how good we have it compared to here in the Philippines. That they can couldn't provide a simple fever reducer, which costs pennies practically. But again, because they're not well funded, and that's the big problem, not being well funded. And so for that reason, if somebody goes there and they're very poor, because believe me, some people, some families can barely feed themselves here. When I say barely, they eat rice every day, and they're happy that they even have that. So for them to go out of their way and pay for the medical visit, hospital visit, and also have to buy medication, it's not a lot of money, but to them it's a lot of money because they have nothing. And so we got the medication for a child, and then stayed there for another 2 hours. And I talked to the doctor. I said, he spoke pretty well English. I said, if you don't mind me asking, I'm not family, I'm just a neighbor, just helping out, a good Samaritan. I said, what's wrong with the little boy? And he says, most likely it's due to some kind of a birth defect, some kind of chemical imbalance in the brain that causes a different kind of seizure. I don't know how he explained it, but that can happen to him, and it can actually take his life away. His heart rate went very low, his fever went up like crazy, and I don't know what else, but it was already too much too much information. So as I said, we stayed for a couple of hours, and then asked the doctor, do you want us to stay around? And he says, no, we don't really need you. But he thanked us, and we thanked him too, his dedicated work. And I couldn't help, as I said, it was so hot in there that you can see the sweat running down the nose of the doctor, down the paperwork and everything. And it just shows that, they're stressed out and no air condition and way overloaded it nonstop on a daily basis. He said it's like this. Patients after patients after patients, day and night. So very, very underfunded. And good thing that there's still dedicated doctors and nurses willing to do it in that conditions. And because of that, too, that condition problem, many of the nurses, especially from the Philippines, are highly sought after in the United States and in Europe because they're so dedicated workers and so honest. And so we asked the grandmother too, you want us to contact anybody? And she said, no, she will contact the father and the mother from the hospital. And I said, okay, just let us know. You left our phone number if you need us to come and pick you up or anything. And then went home, and then that same day, the family came home from work at 10 o'clock at night, and they went to pick them up with a motorcycle. And they were very appreciative to us. We didn't even mention the medication we paid for or anything. It doesn't make any difference financially to us. It was just a good thing to help, a good feeling to help. And see the kids getting better. So that's my little story about the experience we had with the healthcare system here. Right? Thank you for taking the time to hear my story, and all of you have a wonderful day.